Hi. So I guess this is part 2 to my last video talking about this. It is super loud because there's like a storm happening outside. So sorry about that. It's literally so loud. Like, we're working with natural light, which we don't got a lot of right now. It's probably for the best because I didn't want to put on makeup because I don't need to wear makeup today, and I didn't want to put it on just to film this video because, like, why do I need to look good for this video? I filmed the last one a week and 2 days ago. This is just kind of the first time I've had to sit down and finish, or who knows, maybe there will be 19 parts to this. Probably not. That would be really fucking excessive. I think the benefit in not having time to do this for like over a week is that I'm not as emotional as I was that day, and I'll be able to be more concise, hopefully. Honestly, I usually can't get to the point even when I'm not emotional, so I don't know why. Anyway, I just want to cover the things that I didn't get to in the last video because it was like I was on a roll of telling how things went and like the order of events and everything. And then my camera died, and when I came back, I was like a fucking disaster. I also had just gotten a spray tan, but I wanted to talk, I think like the place where I kind of left off was like surgery day, and I talked about after surgery, but like I want to go back to my surgery day. So as I mentioned in the last video, I was about 11 weeks along. However, I didn't even find that out until after surgery, but even with them telling me I was almost 8 weeks along after I had like the ultrasound, even if it was 8 weeks along, due to how everything was looking, I guess, and just the risk of my tube rupturing and the fact that I was already like starting to have some sharp pain. That's kind of why I had to do surgery, because basically if you catch an ectopic pregnancy like early enough, there's something called methotrexate. I believe it's primarily used in cancer patients, and actually I think commonly like in uterine cancer, ovarian cancer, and then also like neck and like I think leukemia, probably lymphoma. I just pulled that out of my asshole, but I would imagine because it's a lymph neck. I don't know. Anyway, it's a type of chemotherapy and like immunosuppressant. So they would inject that into my fallopian tube, into what we thought was an embryo, but ended up actually being a fetus. And that would basically just stop cells from growing, and so like effectively ending the pregnancy. And then from what I remember, they said that like if I were to be able to do that over like a month to 6 to 8 weeks. Bug is taking a shit right now. She sticks her head out while she poops. It's fine. Anyway, the pregnancy would be absorbed by my body. I guess in that case you wouldn't have to pass it, it would be absorbed. Not really sure how that works. I understand the concept, but also if I were to do that one, then I would have had to come back. I think they said for like 4 to 6 weeks, once or twice a week, to have my HCG levels monitored to make sure that I, wasn't pregnant anymore, that the hormones had gone down. And then sometimes, if your blood test comes back and the hormones aren't lowering like they should be, then they'll give you another injection. Honestly, even if I was eligible to do this, I do not think I would have done this. Obviously, you're not doing it for no reason. You're doing it to save your life, but also at the same time, like having a medicine like this in your body, I was like looking it up and everything, and like the mortality rate increases, and it's just not something that like that I would choose to put in me. Obviously, like if it was the only option, yeah, but I probably would have chosen the surgical route anyway because I've had so many surgeries in my life. Also, I think aside from the fact that I was pretty far along and already having horrible side effects or horrible symptoms, I think like my levels of HCG were too high for me to even be eligible to have the methotrexate shot. Anyway, I was just saying that because a few people had commented saying that they had had ectopic pregnancies and that they went that route with it, and it just made them feel really sick and awful. So something I don't even think I touched on in the first video was that I've been referring to it as an ectopic pregnancy. I think it technically still is. I think it's like 96% of ectopic pregnancies are tubal, which means it's in your fallopian tube. Technically, mine was in my fallopian tube, but of course, because after everything that fucking happened, that was just like 1 in a million after 1 in a million, maybe not 1 in a million, but just like rare after rare after rare thing happening to me. And like, how did I even get to the point of having an ectopic pregnancy when I wasn't fertile, endometriosis, on birth control? I have one of the most rare kinds of ectopic pregnancies. I'll put it in here because right now I can't remember what the third one is, because there's a cervical, which is when it's like, I think it's just like blocking your cervix. There's cornule. I'm not even going to try to define what they are, but I do know that what I ended up having is an interstitial ectopic pregnancy. And basically what that is, instead of just like being in the tube, I don't even want to like say centimeters because I don't know, but just if you just imagine a fallopian tube and a uterus, it's like chilling in the middle of the tube. Interstitial is when the gestational sac, I believe is the proper term, it implants itself at sort of like the most proximal. I love trying to sound like I'm a doctor. I'm not. I'm trying to explain because I'm visualizing it in my head. Oh, interstitial is cornule, I think. I'll put in like some diagrams or something. I don't know. This is how I'm gonna put it. This is probably not correct, but like where the tube meets the uterus, basically. It's implanted in there. Almost as if like, bitch, you were almost there. Like, oh my God, not me calling. Okay. Basically, that part of your tube is like the most vascular, and so that means you're at a higher risk of hemorrhaging, which you're already at a really high risk of hemorrhaging, especially knowing, you know, that I was like 11 weeks long. It's honestly a miracle. Like, as shitty as all of this is, like, it could have ended so differently, and I'm aware of that. Anyway, I think it's like the most rare occurrence for it to be interstitial, which is, like I said, it's like when a river, it's like where a river meets a ocean. Rivers don't lead to oceans. Do they? It's like where a little river of water meets a pond, which is the uterus. Anyway, sorry, I'm over explaining myself. That is a trauma response. Okay, I'm reading this right now because I wanted to look up like actual percentages. And this says interstitial pregnancy accounts for 2 to 4% of all ectopic pregnancies. It tends to rupture at a more advanced gestation compared to tubal ectopic pregnancy. So that kind of explains how I was that far along. I have no clue if this is right, but it kind of makes sense to me because it's like, it's not just confined to the tube, like it is partially, because your uterus is right there and it's open, like maybe that's why it can be a little bit bigger and you can be farther along. That could be totally wrong, but I don't know why else it would tend to rupture at a later gestation. That's just my little hypothesis, I guess. And when ruptured, hemorrhage is usually profound. The mortality rate of ruptured interstitial pregnancy is 2 to 5 times higher than that of tubal ectopic pregnancy. Early diagnosis of interstitial pregnancy, especially before rupture, is therefore desirable in order to reduce its morbidity and mortality. However, preoperative diagnosis of interstitial pregnancy is difficult. Wow. In the past, this type of pregnancy were only diagnosed at laparotomy following its rupture, resulting in a hysterectomy rate as high as 50%. I just gotta chill. It's crazy to think that if it had ruptured, like if I hadn't taken the test, if I hadn't gone to urgent, like if it had ruptured, hysterectomy rate being 50%, and after like every odd that I would say I beat, but no, the odds that kind of failed me, I would have a 50% chance of having hysterectomy. I can't even imagine. Wow. Misdiagnosis and delay in appropriate management still occur frequently. So this is interesting. I didn't even really look at this, and I didn't talk about this in the last video, but I remember just saying like it's crazy that I was so far along, and like they usually would discover it before. And this study that I'm reading is saying they had 1,346 people with ectopic pregnancies, and of that, 39 of them were interstitial, which is 2.9%, and the mean gestation at presentation was 9.3 weeks, which is pretty far along also. Very far along. Many of the women had endometriosis, and only 5 of the 39 was interstitial pregnancy diagnosed preoperatively. In 12 of them, they already had it ruptured, and 11 of them developed signs of hypovolemic shock. 1 patient required hysterectomy. Okay, so anyway, I don't need to even be looking at this anymore. Wow, this even says, okay, I'm looking at this study, it's super interesting. The people are numbers, and it's saying what their symptoms were and what they were diagnosed with initially, and how they managed it, and then the subsequent outcome. Person number 1 presented with irregular vaginal bleeding. Initially was diagnosed with an endometrial polyp. To fix that, they removed an endometrial polyp. It says failed, and then it says DNE, which is dilation and evacuation, and then the outcome of that was a rupture 4 days later. She had a total hysterectomy. A lot of these are saying the diagnosis was that their IUD failed. Most of these are saying that. Sorry, I'm getting so freaking sidetracked. God damn it. I'm not supposed to be like educating you. I wanted to just talk about my experience, but it is interesting. And I mean, they told me this on surgery day. They said these words to me, not all of this, but that it was interstitial, whatever. And I just, like, I was so out of it before, and then after, I didn't have the energy to like, you know, be looking into all of this, but like whatever. When I called my dad and told him, I think my mom asked as well, one of the first questions was like, I don't know if he asked like, did they go through your abdomen, or like, so do you have like an incision in your abdomen or something? And I was like, no. Like, it didn't even occur to me that usually when you have an ectopic pregnancy, the usual way, unless you're doing methotrexate, I think the usual surgery is a laparotomy, which is when they make an incision, remove it that way. I didn't know that because from, you know, I mean, everything happened so fast, but from the day before surgery, I knew kind of what they were going to be doing, which was a D&E. So essentially, they went through my cervix to my uterus, and then because it's an interstitial ectopic pregnancy, that's like the preferred, less invasive, I guess you could say, because you're not having an incision, way to remove the... because it is interstitial, and like maybe part of it is like in the uterus, but it's held on by like the walls of the fallopian tube. Maybe they wanted to do that so that they can make sure they get everything, or so that they don't damage a tube. I don't really know. All I know is that that is what they recommended, that, and I just fucking listened. Honestly, I was so out of it. I just was like, okay, do whatever. Now I'm looking at this study and it's saying that that's what they did for everyone after they found out that they had interstitial. I had a really hard time, and even now, knowing what I know, it's still like, for some reason, is like fucking with me a little bit. But with the fact that in my brain it was like, if it's that close to the uterus, you know, can't they just remove it from there and place it in the uterus so it could continue to grow and everything? But absolutely not. No matter where it is implanted, if it's in your tube, in your ovary, interstitial, you can't just simply move it into the uterus. That's not even an option. But I don't know, something about that in my head, I'm seeing it like in a, I guess, dumbed down way, which is like, it was so close, you know. But that's not how it works. It's just not how it is, and I'm just lucky that it didn't rupture. That the fact that like I went to urgent care and had the abdominal CT before I even went to the clinic, because I feel like if I got to the clinic they would have done like an internal ultrasound and been like, there's nothing in your uterus. Maybe they would have seen a little bit, I don't know. But like the fact that I had the scan first and they told me it was ectopic, then I could then go to the clinic and have them know that, instead of just thinking like, oh, she's pregnant. And I don't know, I think that was, I got lucky with that. And I don't remember if they told me that it was interstitial before, but they did tell me. And I remember telling my boyfriend on the way home from the first appointment at the clinic, like, they told me that it's like on the edge of my uterus. Like, it's in my tube, but it's like in a super rare spot where it's like on the edge of my uterus. I don't know, that doesn't even make sense. But, and that was before, like, obviously when I got home I started looking it up, but at that point, like, I just remember that drive home, I was like, but it's so close. Like, what if, I wasn't even thinking like, oh, if this ruptures, it's going to be very potentially fatal or result in a hysterectomy. I don't think they even told me that hysterectomy thing, but I was just like it's like on the edge of my uterus, like it's where the tube and my uterus connect. Like, even knowing that, that doesn't mean that they can just push it on down and have it survive. I don't know. I kind of wish I wouldn't have known that. I wish I kind of just could have been a bit oblivious to that and naive to that. But who knows if that would have changed the way that I feel. I think I still would have felt probably pretty much exactly the same had it been a tubal pregnancy, tubal ectopic. I don't know, higher up in my tube. I don't know. It just does something. It kind of just fucks with my head. Because you just look at the picture of it and you just think like, just push it down a little bit. Anyway, so I had a D&E. And then I think I've already talked about after surgery. I don't know if I got to talking about my symptoms before. I know I said like I was feeling really sick and nauseous and stuff before I knew. But I made like a list of my symptoms. And I was experiencing these for over 2 weeks. And they progressively got worse and worse. And like I explained in the first part, you know, why I was not thinking I'm pregnant because of these symptoms. Nausea all day, every day. And then like about a week before I found out, I was like dry heaving a lot. Every time I would cough, I would be like gagging. And this is, if you know me, you know this is weird because I've thrown up like 2.5 times in my life. Like, I'm not a puker. There's been times where I'm like so sick and I just want to throw up because like I know it would make me feel better. I literally can't. Like, I can't throw up. And I mean, I wasn't throwing up. I was like dry heaving, but like still. It was very weird. Extremely dizzy, extreme fatigue. I talked about that in the last video. Like, I've never felt that level of fatigue. Rectal pressure, which is something I only thought about in hindsight. sharp pain, and then that led to like the super intense sharp pain on my left side, back pain, weird shoulder pain, and neck pain, which I didn't think would be related, but the doctor told me that that was a common symptom, is shoulder and neck pain and back pain. I always have low blood pressure, and I'm not always anemic. I actually believe I've been okay for several years on that front, but since I was little, like when I was little, my mom would have to give me liquid iron because I was anemic. My blood pressure got even lower than it usually is, and my anemia was so bad that they actually, before surgery, I don't know if I mentioned this, they took a little bit of my blood, or actually they took a lot of blood, and they were saying like normally if we took your blood and saw this low of an iron level, like we would literally make you take iron for a few days in order to operate, but because of like this urgency of the situation, they were like, okay, we have to do surgery, so hopefully everything's fine. Bloating and gas sensitivity, super sensitivity to smell, insane. Irritable, that was more so before I was feeling really sick, because when I was feeling really sick, I just like couldn't even feel. Tender breasts, enlarged breasts, super veiny breasts, which I really only noticed when I found out that I was pregnant, and I sort of like was putting things together, and I was like, this is so weird, and I looked at my boobs and I was like, how did I not notice this? But it's just because I was like wearing hoodies every day and laying down, like I wasn't, I really wasn't aware of what the fuck was happening with my body. Peeing a lot, all that. So kind of like the intense pregnancy symptoms mixed with the added ones that come when you have an ectopic pregnancy. I also was looking at like risk factors of an ectopic pregnancy. There were 3 of them, I don't know how many were on this list, that perfectly fit my situation. History of infertility, endometriosis, and an IUD or other POP, which is progesterone only pill, at the time of conception, which technically I had an Expanon, which is for all intents and purposes like basically an IUD for your arm. I mean, it's not, but it's progesterone only. After the surgery, the first week or so, I think I talked about this actually. I wasn't bleeding very much until one night when I was having super bad cramping and contractions and all that, and that's when I was passing. I don't know. I was saying to my mom, I'm like, I think that was like placenta and like embryonic sac. And she was like, I think they would have gotten that all out. And I'm like, well, but it wasn't blood clots, like it was something else. Still don't know, but I talked about in the last video how my skin was terrible. Luckily now it is doing better, so I think that's good. Obviously my hormones are well, actually I'm taking the mini pill now. I did say I was going to stop. I thought about it and I was like, would I rather just feel shitty for a couple months and feel like really shitty, or would I rather feel shitty for a month to 6 weeks because of everything that I just went through, and then get my hormones back to baseline, and then start taking the pill, and then feel shitty for even longer, like it's almost like just like get it over with all at once, honestly. And then obviously 2 weeks after you saw me literally in the last video, it was 2 weeks after I was emotional. I talked about like the cycle of how all of that, the level of at least like sadness and sobbing, like that is dramatically, knock on freaking wood, lowered. It feels less like uncontrollable, whereas before I was saying like I literally could not control my crying, and I couldn't really explain why. Now it's different for sure. I'm not like crying. I think I've cried for like a week, but it's sort of just like a overall, I don't know, maybe I'm just still in that cycle of what I was talking about, like apathy and then depression, sadness, whatever. Maybe also it's because my hormones are figuring themselves out and my body is figuring itself out, because now like when I think about it, when it pops into my head, yeah, I feel emotional about it, but it's not like the level of insanity that it was before. Now I'm at the point where I'm like able to think about it and try to process it, because I know that's important, especially for me, well, for everyone, but I know in my experience, like taking it all the way back to 2016 when I had some traumatic things happen back to back and I did not acknowledge them. I started working 2 full-time jobs, literally not feeling anything, and I got really, really sick. I just know that when I don't process things, they start to really affect me physically, and obviously eventually emotionally, because you have to confront things. But I'm at the point where, since I'm thinking more clearly and I'm not feeling so like insane, I'm trying my best to take some time for myself, and I'm not doing a good job at that. Yeah. I say I'm trying to prioritize myself and my healing, but I'm not gonna lie, like I haven't really been doing that, and it was really hard on Christmas. I wasn't able to be with my family. I've sort of been reverting to like working a lot and distraction, but I will say I'm doing better. Like I normally always have like some kind of sound in the background, podcast, or not usually music, usually like podcast or audiobook, something that's like stimulating my brain, which is great, but I know that I do it a lot of times as like an avoidance thing, so I don't have to think and feel things. And I've just been trying to have more silence, like when I drive, when I'm working. It's fucking hard, man. What else? I feel like it's hard too, and whatever, this is just how I'm feeling. So I really am like try to prioritize myself and taking care of that sounds like a foreign thing to even say, taking care of myself. And I just feel like I don't have a lot of people in my life that are understanding of that or encouraging of that, and the ones that aren't geographically very close to me, except for there's a couple, but actually they're both out of town. And so it's hard because like I sometimes, usually, always need someone to tell me that it's okay to prioritize myself and that I don't need to be doing XYZ, but I sort of have the opposite of that happening right now. And that's not to say I'm not surrounded with good people, and that's not to say I don't love the people in my life, but they're not experiencing what I am, and maybe their way of coping with things usually is like it's just different or whatever, and that's fine, but it just makes it a little bit hard for me because it's already hard for me to like, I don't know, I am a caretaker. I take care of others, for better or for worse. Like I know it's not good to do as much as I do like all the time, and I know that it's, you know, trauma response and this and that and all of that, but it doesn't change the fact that it's really hard for me to put myself first. Anyway, so yeah, I'm still sort of in that cycle, but it's the threshold is like a lot lower. It's more of like a baseline apathy with like marked. I usually only get really emotional the past week or so when like something triggers it, and then I don't know, it's hard. I honestly, I should make some sort of follow-up video in like a month, because I guess I'm still at the point where I'm not really even sure how to explain properly, or maybe I just am such an over-explainer that I didn't need to try to put you inside of my brain. But speaking of being an over-explainer, I think I mentioned in the last video, like I feel like this really triggered my PTSD. I don't even like necessarily saying I have PTSD, but I don't know how else to put it, which was quite well under control and managed for almost 2 years, and then like, which makes sense, I guess, you know, yeah. I also just sort of overall feel like this whole experience, I think it's just going to be a lot to process, and I feel a little bit lost in life as a result of this, or just after this, which is, I don't know that I felt that way. I feel like once I like was 25 for sure, the last 2 years, I felt like, whoa, I like know who I am now. Yeah, I'm still learning and growing and all of that, but like it's so different than when I was like 21, 22 and just like such a mess, like didn't know how to like manage my emotions. I don't know, I just feel like I really like came into myself, and then like I just, because I have always done a lot of value work, I always have like this, I'm like getting so far off the point, but it's been easy for me to like not feel lost in life, because if I'm ever questioning something, I go back to like, does this align with any of my core values, and like if yes, then it makes sense, and if no, then no. But I just feel like I feel so kind of thrown off and confused, and like I'm rethinking kind of everything about everything. And I'm sure you know how that feels, and it's pretty shitty. But I legitimately have been talking for an hour. I did not do what I said I was going to do at the beginning. Who cares? If anything, I don't have a therapist right now. I did just get insurance that's going to start on January 1st, so in like 2 days. Hallelujah. Hopefully they don't drop me. They won't, because they're not Kaiser. But if anything, like for me, writing, which honestly is something I made a vision board. Sorry, it sounded like it came out of nowhere, but it didn't. It made sense with like prioritizing writing, and also kind of the reason that I started my Patreon was just like I noticed that talking about things, even though I'm quite literally just sitting here talking to my camera. Granted, yeah, you're watching this right now, but it's like a cathartic thing that helps me process when I verbally talk about things, or write them. And so if nothing else, like, it was good for that. I was saying I made a vision board because I'm trying to prioritize myself, self-care, but like just fucking taking care of myself and also healing through some stuff. Writing is gonna be super important, and I feel like a big part of that process. And so anyway, don't know, I should shut up. I'm gonna hate editing this. Yeah, okay. I guess this is the part 2 of my story. I'm not gonna drag it out anymore with like more videos on it. I may update you in a month or so, just on like, because I feel like it's a lot easier in hindsight to notice how I was feeling and why I was feeling that way, especially when you're like going through something traumatic, you know. I tend to have a lot more insight on things when some time has passed, so maybe I will do that. Alright, that is going to be it for this video. All that while I looked like a little boy. Someone commented on my last video, because at the very beginning I was like, so I'm 27 and blah 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 blah, and they were like, you're not 27, you're 12. No, I think they just said like, oh my god, I thought you were like 18. So I was gonna say love that for me in a sarcastic way, but yeah, no, I'm embracing looking like a fetus. Okay, not the best fucking enough. Okay, bye.